Hi, everyone. This is Amelia Keaton. I am joined today by Colleen Roberts and Vicki Reed, who's one of our infection preventionists and public health nurse consultants. We have a fairly short agenda today, so let me just go ahead and share my slides. So just in case folks want to make sure they're on the right call, this is our weekly updates for long-term care facilities. We tried to make sure that we've shared this invitation with everybody that we are aware of, and we've also asked our licensure folks to share as well, but feel free to forward the WebEx invitation for the series to anybody who may not have received it. We've tried to make sure that all lines are muted, but if, as you join the call, if you could make sure that your line is muted, that would be extremely helpful. We will share the slides and materials presented on this call after the call. As always, there is a bit of a lag for the report or for the recording portion to be processed, so it might be the end of today or tomorrow before that can be sent. And as always, if you have any questions regarding infection prevention and control, please email our hai.health@tn.gov inbox, and we'll get back to you as quickly as possible. I also wanted to reshare some of the resources that we discussed last week for the weekly employee testing of long-term care facilities. Again, this is required for skilled nursing facilities, but optional and encouraged for assisted care living facilities and residential homes for the aged. So all of the resources are available under the healthcare tabs at the Tennessee Department of Health COVID landing page. For questions about testing in general, we ask folks to email covid19.testing@tn.gov. If you have questions about payment, billing, or reimbursement, please email covid.invoices@tn.gov. I know that's something that a lot of folks have had questions about. And then if you have other questions regarding the enforcement of regulations or the emergency rules that laid out the requirements for employee testing of long-term care facilities, please email ohcs.health@tn.gov. The OHCF there stands for Office of Healthcare Facilities, in case folks are wondering. So again, not a lot to discuss today, mainly just the status of COVID-19 in Tennessee. Colleen's going to present some NHSN updates, and then we're going to leave plenty of time at the end for questions and answers. So I imagine most of the folks on this call are aware that we have been seeing a pretty steady increase in cases across the state, across the week. We've had a few days in there that included record numbers of new positive cases. Nashville, in particular, has issued a mandatory masking in public mandate. Other areas have not done that yet, but we are still seeing a lot of folks going out without masks, and we encourage everybody, whether you're at work or not, if you're going out into public and are not able to enforce social distancing, to please wear a mask. You know, I know that it's not a perfect solution, but it is something that we have pretty good evidence can at least decrease the transmission of COVID, particularly for those folks who are asymptomatic. Our hotspots sort of remain the Middle Tennessee and Shelby County areas, which I know is no surprise. As of yesterday, we had 1,212 new cases across the state. Our fatalities are still being reviewed on a case-by-case basis, but we had 12 new ones confirmed yesterday. Our hospitalizations are increasing, as one would expect, as our case numbers increase. We are still seeing some shortages in PPE components, which I know is not a surprise to the folks on this call, but as we see more cases, you can expect some of those really critical elements of personal protective equipment to be short as well. So a concerning situation, but one we are working really hard at the Department of Health and across the state to help address. In terms of cases within long-term care facilities, as of the end of last week, which is when we are updating our case counts publicly, we have identified 165 licensed long-term care facilities with at least one or more cases of COVID-19 among residents or staff. The breakdown is 117 skilled nursing facilities and 46 assisted care living facilities and 1 residential home for the aged. There are over 1,100 residents or patients that we are aware of that have been diagnosed with COVID-19 and over 550 staff. And I think as we start to see the cases increase across the state, we are also seeing increased long-term care facility clusters and cases as well. And so we expect that this number will increase with our weekly reporting on Friday. I wanted to just put a plug out for the Battelle Critical Care Decontamination System, which is a system that is available to all healthcare providers and facilities across the state to decontaminate N95 or N95 equivalent masks. We know a lot of folks out there are using N95 masks for prolonged periods of time just due to the shortage of these. This is one option to help decontaminate them using vapor phase hydrogen peroxide. I just want to emphasize that this is a free and relatively easy service to use. So FedEx will come to your facility and pick these up, and then they will deliver them back to your facility. There is usually a week to 10-day time period where the masks will be processed, but still it's free. It's a pretty good resource, and it's effective in removing pathogens from those N95 masks. I will say that if you choose to utilize this system, masks that have things like makeup or that are visibly soiled will be rejected. So similar to what we know about other disinfection processes of surfaces, you can't easily disinfect something that is visibly soiled. So if you are a lady out there like myself and need an excuse not to wear makeup, this is one that I would put a plug in for. And if you have more information and want to enroll, the website is right there on the screen, and you can go in and they have a frequently asked questions document as well. And I will turn things over briefly to Colleen Roberts to talk about our NHSN reporting.
Okay, good afternoon, everybody. I just have some quick slides for you. Again, just trying to give you guys a weekly snapshot of what we're seeing in NHSN. So while the data up on CMS website is a little bit further behind because they have a little bit more delay, we're trying to pull the data every single week and taking a look at it. So the data presented here is the past week, and that is Monday, June 22nd through Sunday, June 28th, as that's kind of the calendar day period that the data is looked at. So you can probably notice right off the bat here, I sort of have a flag on this residence admission. When I looked at that total, it was 184, which we don't believe to be correct. So every single week when we look at this data in NHSN, we kind of try to do some data quality checks on it and see if it looks like, maybe people were reporting numbers slightly incorrectly or just not fully understanding either the definition, or sometimes there's just typos that people make, or you meant to put that in your census and you accidentally put that in your admission count. So we were following up on a couple issues like that. So, kind of be aware that that's something that might be happening on a weekly basis. Usually we've been working with Sarah Sutherland at Q-Source, where perhaps Vicki Reed might be contacting you all just saying, hey, we noticed this number looks a little strange in NHSN. Are you sure that's correct? So we're trying to provide that service to you all as well, just making sure that that data looks correct that's going to CMS. So we had 70 confirmed cases, 30 suspect cases, and 10 deaths reported in positive COVID patients, or residents, excuse me. And then from the staff impact side, we had an additional 65 confirmed cases and 72 suspect cases. So on the next slide here, this is just what I've been continuing to show you all every week, just to have this information in front of you, where you can find the data that CMS is publishing on their website, and how you can check that. And then noticing that, like I said, that data is on a little bit of a lag. So right now, if you go onto that website, you'll only see data as of the week ending in 6/14. So it's not as up to date. And then again, there's a couple email addresses that you guys can contact if you do not see your facilities data on CMS's website, or if you have some questions, if you have each week, if CMS is kind of saying that your facility has not been compliant or hasn't reported data, facilities have been getting emails. So, you can sort of follow the instructions that you get in that email about how you can follow up with any disputes that you may have with that. And that's also one of those email addresses, this sort of enforcement email address. So just know that if you're getting that information, or if you're looking on the website and things don't appear right, there are a couple different resources you can reach out to try to get that corrected. And then finally, the last update that I have was just another reiteration of what the definition suspected COVID-19 means in the long-term care module here. And I know we've talked about this on this call, but NHSN sent another email to users I think that was either yesterday or Monday, just re-emphasizing this point because as you all are aware, many states and, us in Tennessee being included are doing wide-scale testing in facilities, doing, weekly repeat testing, things like that, that you do not count a resident or staff member into that suspected bucket unless they have signs and symptoms suggested of COVID-19. So as part of that testing, if you're just doing in-house testing across your residents or that weekly testing of staff members, they're not being considered suspected as far as NHSN is concerned unless they are actually exhibiting signs and symptoms. And I think you all have been doing pretty well on that front. Like I said, we've been checking the data every week, so we haven't seen too many things that look like you all might be interpreting that suspected definition in that manner. But we just want to make sure that we keep reiterating any information when it comes to those definitions to you all. So that is all that I have, and I'll turn it back to Dr. Keaton.
Awesome. Thanks, Colleen. So let me get things over to our chat box so we can answer some questions. I also want to stop and check to see if anybody from our Health Licensure and Regulation Division is online. So I see Caroline Tippins, so I'm going to unmute you.
Hey, Amelia, this is Caroline Tippins.
Hey, Caroline. So I'm just going to start, I guess, reading some of these questions, and we can kind of tag team answering them. So we've received several questions so far regarding returning from vacation and employees who may have missed 1 week cycle of testing. And I know Caroline and her group are working on crafting some guidance, but Caroline, do you want to provide a bit of a summary of your group's recommendations for those employees who might have missed one cycle of testing for vacation?
Sure. We are going to be issuing some revised FAQs, hopefully. I don't want to say tomorrow, but hopefully as soon as possible. We're thinking probably by close of business tomorrow about how vacation testing should be handled. And about those employees who may be on a cycle that makes it difficult to do a weekly testing. So we're going to be issuing a little bit of guidance on that. We're also going to be issuing some guidance about what the definition of staff member or employee is about contracted individual entities as well. As I know, we have received multiple questions about employees who are contracted and who should be tested and who should pay for that testing. So that guidance will be forthcoming.
Great, thanks, Caroline. I know another question that I'm seeing a few times here are for people who recently were infected with COVID-19 needing to return to work and whether they should be tested weekly for COVID-19. It sounds like right now the emergency rule sort of makes an exception for people who have positive COVID antibody testing. Is there any guidance forthcoming for those who may have had a positive PCR test in the past but have not had a positive COVID antibody test?
I think some of the FAQs may address that we're currently working on.
Okay, great. We have been contacted by the local election commission wanting to come and do absentee ballot voting with our residents. Are there policies, guidelines, or protocols in place for absentee voting?
Right. And Amelia, I actually sent you the policy if you would like to share that on your screen, if that would be easy. I sent it to you in a Word document. As you all may know, we had a Board of Licensing for Healthcare Facilities meeting on June 3rd. And at that time, the board promulgated a policy which basically indicates that pursuant to Tennessee Code Annotated 26601B, each licensed nursing home, assisted care living facility, home for the aged, or institution providing domiciliary care shall provide upon request from the administrator of elections a list of all individuals in the institution for purposes of voting the registered voter. The list shall include the names and home addresses of each individual if such address is not the same as the licensed facility. The list shall be requested by the administrator of elections no later than 40 days prior to the election day for each election and shall be provided promptly by the facility. Failure to provide a list to the administrator of elections no later than 40 days prior to the evaluation shall be grounds for deficient practice. I also wanted to emphasize, thank you, Amelia, I also wanted to emphasize that if there has not been already, there will likely be an email forthcoming, a letter and a document that are attached to this document that Amelia is sharing this policy, which indicate that the election administrator has the ability to come in, provided that they wear appropriate PPE. So there will be a document that will be forthcoming in the next coming days that will be shared with the administrators.
Perfect. Thanks, Caroline. And I can also make sure that I distribute this document with the slides and the recording of this call so that everybody has a copy of it moving forward.
Thank you.
All right. So the next question we have is, have there been any changes in allowing visitation? And at this point, there have not been, but I think many facilities are finding that their county no longer falls below the threshold, which is a 14-day average of 10 or fewer cases per 100,000 residents in the county. As we see cases go up across the state, it's understandable that a lot of facilities may not fall into that threshold. And so I think the guidance is the same, although, I think the number of facilities that would qualify to meet that threshold is probably fewer now than it was a week ago. And I believe Caroline also mentioned in their incoming, or their guidance is under review at this time, that they will further define categories of contract employees, including EMS employees, et cetera.
Yes, there is further guidance forthcoming.
I can also say that updates regarding salon services, communal dining, and other activities are also under review. I'm not sure exactly where they stand at this point, but we have definitely heard that those are being prepared and being reviewed. So I promise we will share those as soon as we have more information there. So we received a question that if an employee presents documentation that they have antibodies to COVID-19, would they still be required to get tested each week? And based on the emergency ruling of the Board of Healthcare Facilities, they would not have to get tested each week. That is one of the stipulations in their document, I believe.
That's correct about the positive antibody test.
We received a question regarding whether there are any indications that the state will close again related to increased COVID-19 cases. That's not something I have heard anything about. I do believe, there's increased stress on just doing some of those things like social distancing, wearing masks when you're going outside. I know the governor is giving a briefing today, and he may provide more information there. I have not heard anything so far of the state closing, but obviously that could change, due to the increased number of cases that we're having. We received a question regarding if outside vendors tested our facility, do they count in our totals if they are not an employee? So that actually is a good question that I would have to check with our cluster team on how they're calculating that metric right now. I don't believe that they would count towards your totals, but I can double check there. And we've received some questions regarding employees being able to refuse testing. So they will be able to refuse testing. The facility just needs to document in writing that the employee has refused that testing. So I don't believe that will be changing. Assisted living facilities at this point are not required to test staff or residents weekly. They are encouraged to do that, and the state will reimburse for testing staff weekly, but they are not required to at this point. At this point, it's only skilled nursing facilities that are required to test employees weekly, not residents weekly. And Caroline, this would be a question probably for Vincent, but we have received a question stating that CDC states to treat COVID waste as routine, although some facilities have been cited for not putting COVID waste into red biohazard bags. I imagine that would probably be something for Vincent Davis's team. I don't know, Caroline, if you have any information on that.
I will say that there is, okay, go ahead.
Dr. Amelia, I am on the call. There have been some questions in that regard, that's something that I'm looking into, and we'll be able to follow up and probably put it as part of the F and Qs.
Great, thank you. I didn't realize you were on the call. Thanks, Vincent. So I don't believe that you have to have a consent form signed each week by staff to undergo testing, but staff who do decline testing or refuse testing are required to document that. And the facility, I think, is given some leeway in developing their own form to document that. It's just basically to document those who were not tested and that they were not tested because they refused. One question that we received is there a reimbursement program if an assisted living facility decides to undergo testing every 7 days? And there are, and it's on our website, and the link to access that guidance is on, will also be on the slides that I send out later. So if you are an assisted living facility and would like for your employees to be tested, the state will reimburse for that, and there's instructions on how to do that. And just to clarify, at this time, Nashville-Davidson County, which is under the Nashville Metro Health Department, which is a separate entity from the state health department, has issued a mandatory masking in public places mandate. So that is different from the state. I don't believe Knox County has issued one of those at this time. My understanding is that Nashville-Davidson is the only place that's doing that at this point. And there are further details of that online. With regards to allowing aides, social workers, and others, so I believe their facilities should be able to allow what would be considered essential employees, so home health aides and others that are necessary for the health and well-being of residents. Those employees are allowed to come into facilities. We just ask that they mask at all times and follow some of those good infection prevention and control measures that are in place for other employees. I believe that Caroline Tippins has said that there will be further clarification on other employee classifications coming out hopefully by the end of the day tomorrow. And then we received a question regarding documentation of new admissions to a facility who were found to be COVID positive on admission testing into NHSN.
Yeah, so the way you would document that is that would just go into your confirmed cases total, since that is a positive person that tested positive. You would not report that under the admission category. Remember, when we're talking about that resident admissions category, that is in reference to residents that you are admitting from a hospital who were treated for COVID during that hospitalization. So that's the only people that would get counted into that resident admission category. That's specifically in reference to people that were hospitalized and treated, and then you're admitting them into your facility. So you're admitting somebody into your facility with that was previously hospitalized and treated for COVID. If you're doing testing of anybody in your facility and they're positive, then they would just be counted into your confirmed cases total for that week that you're reporting.
So let's see. We received a question regarding the isolation of new admissions, even with a negative COVID test on admission for 14 days. So this is not a requirement. It's a guideline from the CDC for new admissions. And the reason that they are recommending this is that even if a person has a negative COVID test on admission, that doesn't mean that they may not develop COVID symptoms or even asymptomatic COVID infection at a later date. And so their guidance is to place that patient into isolation with transmission-based precautions for COVID-19 so that they can be monitored closely. And if they are one of those individuals who may be incubating COVID-19 and may be pre-symptomatic, that they do not spread it to others. Again, it's not a requirement, and we know that this isn't possible in all cases, particularly facilities that have a shorter stay or where residents need to have rehabilitation therapy and those sorts of things. but it is, something that is the best practice, just because we know that there have been a lot of cases where people might have had a COVID test that was negative on admission, and then they subsequently developed symptoms 5 or 10 days later. So it's just something to think about there. And then we also received another question about how to handle facilities where one staff member has tested positive. So I think the guidance there is to have an incredibly low threshold to test others. We know that particularly if one staff member tests positive, it's often difficult to determine everybody that staff member had contact with if you're doing contact tracing. COVID-19 is also incredibly contagious. We've heard cases where, a facility had one person that they felt or that was found to be COVID-19 positive. Mass testing then identified many, many others who tested positive. Either we or your local health department can kind of help do an assessment in determining if mass testing for everybody is recommended. But I, again, would just emphasize that facilities have a really low threshold for doing that. We've received a couple of questions regarding beauticians and beauty shops. So again, I know that this is something that has come up multiple weeks in a row. We're still working on trying to come up with guidance. A lot of that comes from our unified command and at higher levels, and is based on an assessment of things such as the case transmission in a state. And so I promise we will distribute that as soon as that's ready, but I do know that there are guidelines that are on review right now. And we just also got a message that Shelby County has also now enforced masking in public mandate. So that would now be Shelby County and Nashville-Davidson metro areas that are having masking mandates. And then in terms for voting for nursing homes this July, I will send out the guidance document that Caroline Tippins from Health Licensure and Regulation went over earlier so that everybody has this in writing. So we have a question regarding a person under investigation who tests positive. Would that person count as a PUI and a positive in weekly reporting?
You're reporting each week. We have a PUI for 3 days and they end up positive. So would they be counted in the suspect cases or positive? I think you would report them in both categories because they were a new suspect case and then they tested positive, so they were also a new positive case in that week. So they met the definition for both categories essentially during that week.
And we also received a question, does the county threshold for stopping visitation apply to the outside visitation or only for visitation that takes place inside the building? So it's all visitation categories. So if your county is above that threshold for visitation, no visitation of any kind is allowed. And then we received another question, and this would probably be for you, Vincent or Caroline. Are legal services, such as attorneys, paralegals, or care coordinators, considered essential and therefore allowed into long-term care facilities to see clients?
That's a good question. Let's have some internal discussion on that probably, and we will get back to you. If that individual that asked that question would go ahead and submit their contact info into the chat box, we'll get back to you on that.
Great. And just also to reinforce that the Health Licensing and Regulation Division are going to be releasing more guidance on employees returning from vacation too. So I know we've gotten a lot of questions on that, and some of that will hopefully be answered once those FAQs and guidance documents are released.
looks like we had some comment about whether or not what I had said was correct about counting somebody who was a suspect and positive in the same week. So we'll double check that, and when we send that email, when Amelia sends the email out with slides and everything, we'll be sure to verify that information and make sure we are relaying that information to you guys correctly. So we'll double check on that. Thank you.
And let me just pull up, we received a question on where to find those county thresholds. So let me find that link and I'll share that in the chat box. Yes, and so we also received a question about compassionate care situation and end of life, and so that is excluded from the threshold advice, and that was a carve out that was originally allowed by the Center for Medicaid and Medicare Services. So if you have somebody in your facility who is receiving compassionate or end of life visitors, that is still allowed. That is exempt from the other regulations for visitation. So we received another question about the types of employees that would be included in weekly testing. And again, that's going to be addressed by the document released from the health licensure and regulations. They will also provide clarification on EMS staff as well, I believe. So that's coming. We also received a question about quarantine after doctor or hospital visits. So that is not a requirement. I know some facilities have voluntarily done that. It's not something that we at the state level are requiring. We're just recommending that anybody who needs to go to a doctor's appointment or dialysis or to the hospital for just a routine visit and not a stay, that they wear a mask, and that those who come into contact with them wear a mask, and that they also make sure, to the degree possible, to do social distance or to comply with social distancing recommendations. I know that's not possible, obviously, with physicians, but the hope is that the folks who are participating in that medical appointment and medical staff will also be masked and will take every precaution possible to allow those appointments to occur safely. And again, I believe that there are folks in our unified command structure who are reviewing guidelines and recommendations for group activities, group dining, and other activities within long-term care facilities aside from visitation. So we will keep everybody updated as we learn more on those recommendations. We received another question about a new admission to an assisted living facility who has a negative test upon moving in. So the recommendation and the guidance from CDC is for those individuals to be quarantined for 14 days. And I think that would be the case in all settings. Again, that's a recommendation, that's not a requirement. And the reason for that is just that one negative test, unfortunately, doesn't mean that the person may not be pre-symptomatic or may not have been exposed and may not develop symptoms or COVID-19 infection at a later date. And Caroline and Vincent, we got another question about the legal services, so I will shoot that over to you. We received a question asking, I thought communal dining and activities were allowed in long-term care facilities with social distancing and no more than 10 residents. So Caroline and Vincent, I have not seen that that is allowed. I know that that is one of that is listed in one of CMS's stages, which is just a framework for states to use when reopening facilities, but I have not seen anything from the state of Tennessee that allows resumption of communal dining or group activities. Is that your understanding as well?
So, Dr. Amelia, that is correct. I'm sorry. Can you hear me now?
Yep, we got you.
Yeah, Dr. Amelia, that is correct. The guidance that the individual is speaking of probably is the federal guidance for reopening of for the phased reopening for the states, but the state's guidance all speaks to limited visitation, and it does not consider communal dining. So until there is some phased reopening from the state's perspective and guidance issued for that, there is no communal dining guidance from the state perspective.
Got it. Thank you. We received a question regarding staff who have been hired since mass testing that was performed. Maybe they be tested prior to starting work. So there's not a requirement that they be tested prior to starting work. We've seen some facilities that require that, and that's certainly their prerogative to do that. Those employees are welcome to go and get tested at their local health departments or at one of the drive-through testing at no cost to them. But we have deferred to assisted living facilities to make that decision. Skilled nursing facility employees, so if they are new, they would need to get into that cycle of weekly testing that would be recommended in those settings. All right, everyone. I'm not seeing any other questions. We'll leave things open for a few more minutes. I will just put a plug in for next week's call. So we typically have an antibiotic stewardship, infection control, long-term care facility call. We'll be merging that with this call, and we'll have Vicki Reed, one of our infection preventionist extraordinaires, presenting on that call. That will still occur at the same time that we normally have, but if your facility normally participates in those ASIC calls, that time slot will be canceled and that call will be taking place during this noon call. I'll also still be on, obviously, and so will others from the Department of Health, but just know that there will be a difference in speakers next week. All right, and seeing, let's see. We received another question. So just to clarify, visitation is not allowed in assisted living facilities if the county is above the threshold. That's correct. And the weekly testing is every 7 days, so not 4 weeks. Porch visits are okay if your facility is in a county that is below that visitation threshold that we discussed earlier, and there are some pretty specific guidance for that as well to ensure that those visits happen as safely as possible. And the threshold number can be found. I'll post that in the chat box, and I'll also send that out. If an employee tests positive, is it mandatory that they have 14 days of isolation at home? So an employee who tests positive is required to stay isolated and in quarantine for a minimum of 10 days after their positive test results. If they are somebody who has symptoms, that has to include 3 days where they have felt well and not had a fever. And the reason for that is we know that some people, even though they may have one day where they feel well when they're towards the end of their illness, they may again have a relapse in their fever or their symptoms. And so the guidance from CDC is that a person who has had symptoms from COVID-19 stay home for a minimum of 10 days. If they are still having symptoms at 10 days, they need to continue to stay home until they've gone 3 full days without symptoms. We've moved away from requiring 2 negative tests for COVID-19, and that's because there has been some pretty strong evidence that some people may continue to test positive by PCR for COVID-19, even if they are no longer contagious. That might be because the virus that is being captured on that test is dead, but what some initial studies have shown is that that's not viable virus that folks are isolating. And so I think, unfortunately, if you get into the habit of requiring 2 negative COVID tests before returning to work, that you may be waiting for a very long time, even if the person is not contagious anymore. So we are really following the time-based strategy for return to work at this point. All right, everyone. So we will be back next week, and we will share, let's see. We just got a question. With every 7-day testing, does the day of the test count as day 1, or does the count start the following day? Caroline or Vincent? Not sure if they're still on the phone, but we can
Here I am.
Here you go, Vincent.
Looking at the guidance, it says the 7 days of the date the facility completes their initial testing.
So that means that the test would be day 1 or day 0, I guess is the question we're getting.
I will say, Amelia, that's one of the things that we've been talking about that may be addressed in the FAQ about the employee that is not on like standard schedule, where the timing of, let's say the weekly testing matters in that regard. So that's one thing that I think we can consider being addressed in an FAQ, and I appreciate that concern being brought forward.
Perfect, thank you. And then we received a question about the 28-day window with no positive test in a facility. So that's the 28 days without a case in the facility is part of the one of the stipulations in the guidance to allow visitation in your facility. So you not only have to meet that threshold criteria, but you also have to have a facility that doesn't have active COVID cases for the past 28 days. And I can also send a link to the FAQs that Caroline and Vincent were referring to, but it does sound like those are going to get updated in the next few days. So more to come on that. And if a facility has positive cases, we have read that the survey team must complete an infection control survey before visitation is allowed. Is this correct? And I believe that this is correct, Vincent, but correct me if I'm wrong.
So the infection control survey is not necessarily collected with the visitation. Or whether or not visitation is allowed. That is something that is being done by virtue of a federal requirement. So there really is no connectivity in that regard. However, if a facility has a positive case, then yes, the survey team will be taking a look at whether or not the facility has systems in place so that they are addressing that infection in the facility. but it's not based on the visitation of the survey team. Does that make sense?
Maybe you could clarify again. So if a facility has cases, they will be surveyed by your team?
If there is if there are cases in the facility, the facility, the survey team will do a in-facility visit to understand what the facility is doing, what has happened that caused those cases to occur, and what the facility is doing to prevent further spread of those cases.
Okay, got it. But that is not connected to visitation, correct?
That is correct.
Okay, got it. And then we received a question regarding false positives, and that's something that we also have gotten a lot of questions on. So what I will say is that it's really difficult to determine if something is a false positive result. And the reason for that is that we know a large percentage of people that have COVID-19 may never have symptoms. And so, you know, even if they're asymptomatic, that doesn't mean that they are not, you know, infected with COVID-19 and capable of spreading it. The other issue is that collecting specimens at different points in time can result in different results, and that doesn't necessarily mean that that first positive result was a false positive. It just might mean that the person's viral load at a different point in time is lower and so isn't detected on that second test. It's also dependent on how the specimen was collected. We've seen people use multiple different labs for these tests, and we know that different labs have different viral detection thresholds. And so I think it's really difficult from our perspective to really, unless it's specimen, the same specimen from the same person collected at the same time, you know, it's really difficult to say that something is false positive. And I think the implications of saying that something is, you know, falsely positive when that is incorrect is pretty great. So if you have somebody who is contagious and is not on appropriate transmission-based precautions, you know, that could result in many other people getting infected. And so we advise, you know, really taking caution before, and, you know, potentially speaking with either your local health department or us before making that determination. And Vincent, we received a question asking, will a positive employee case result in a survey at your facility?
A positive COVID case by a staff member will not necessarily result in a visit by our facility. As long as the facility is reporting those cases appropriately, there is really no reason for us to visit unless there is a complaint regarding that positive staff COVID case.
All right, everyone. So I'm not seeing any other questions, but again, we will make sure that we send out all of the materials described today, and we'll also make sure that, let's see, we received another question. Is the threshold for visitation a day-by-day number to stop visitation? All right, so maybe it would be helpful if we shared see here. So this is our landing page for COVID-19. And to get to that threshold, what we do is click here where you see the map of Tennessee with the case breakdown. And then go to EpiCurves. And if you scroll down the page, you'll see this recent case rates by county. So right now, looking at Anderson County, and as you can see, it goes by day and shows you the average number of new cases, or the rate of new cases per 100,000 people in the population. And as somebody pointed out, this rate is going to change from day to day to day. What we recommend folks do is look at this number down here, which is below the graph, which is the average rate of new COVID-19 cases per 100,000 county residents over the last 14 days. So even though, for example, this day is above the threshold and the next day is below, it's a lot easier to look at this average because it is not going to change as rapidly, and it should not change from day to day. So if you want to look at another example, Davidson County has been above the threshold pretty consistently, which you can see here. So if you look down here, their average rate of new COVID-19 cases per 100,000 county residents is well above that threshold, and so facilities in Davidson County would not be able to allow visitation in their facilities. If we look at another county, let's find one that we've gotten a few questions about. So Putnam County is another one where we've seen, again, multiple days above the threshold and then a few days below. And looking at this average, they would not be allowed to allow visitation either. And so we are trying to recommend that folks avoid looking from day to day to day, just because we know that that could result in a lot of confusion, but to try to follow this average rate of cases over 14 days, because that shouldn't change as rapidly, and that should give you a better sense of what's happening in your community, and not necessarily have to change plans for people who are planning to visit, if that makes sense. And we also received a question, if an employee tests positive and goes to a local health department within the next day or two and has a negative, is that still considered positive? I would say yes, that is still considered positive, just because, again, somebody's viral load or viral detection threshold should change throughout the course of an infection, and we know that the level of viral material at the beginning of an infection is much higher than it is even a few days later when a person is hopefully further along in their illness and closer to recovery. So that should change. We also received a question about whether it's possible to look at the average case rate for previous days. I don't think it is currently, but we can ask our data folks to include that, because I think that would be helpful for folks. All right, everyone, I think we are going to end the call there. Please reach out to either myself or to our HAI inbox with any future questions, and we will distribute all of these materials after the call today.